Member for Regina Luban.
Madam Speaker, it's hard to rise and talk about such a topic as this, as so many young people are dying across our country. 166 more deaths since this Prime Minister has taken over in 2015 to 2024. That's what we're talking about. People have died, their loved ones. And for this member to politicize his speech as much as he says, call our leader afraid to meet with mothers when he's met with mothers across this country, is actually beneath this member. I have a lot of respect for this member, and his speech was beneath him. And the House Leader for the NDP can yell as much as he wants. But one thing that this member, I would ask him, at the Health Committee, Dr. Nikki Matthews met with Health Committee ministers and said there's 22% increase in deceased BC youth with hydromorphine in their system. That is safe supply. So in BC, there's a 22% increase in hydromorphine in the bloodstream of deceased BC youth. How can he possibly say safe supply is not affecting and killing BC youth?
Member for Courtenay-Alberni.
First of all, that member, Madam Speaker, comes from Regina, where they have 66 deaths per 100,000. That's more than 50% higher than British Columbia. Kids are dying from poison drugs in his community, accessing unregulated street drugs. Guess what? In Saskatoon, where they're selling brownies to keep the doors open of their safe consumption site, the deaths are half of what's going on in Regina, Madam Speaker. When it comes to youth, well, first, it's extremely rare for any young person to be prescribed pharmaceutical alternatives, and it's always led by physicians, Madam Speaker. But, Madam Speaker, I'll go to his question. Young people can access street drugs anywhere, anytime. The streets are flooded. The police have said that is not what's killing youth. That is not what's getting youth addicted to drugs. Addiction with youth has not gone up since safer supplies moved forward. That is a fact. It's published data. They don't believe in peer-reviewed published data. They only support anecdotes, Madam Speaker. That's what they do. And they push it out, and it's harmful and dangerous, and it's costing lives in this country.